Let's take a closer look at some memory disorders. The term amnesia is a general term to refer to the loss of memory ability that might be due to problems with storing memories and/or retrieving memories. Retrograde amnesia refers to the loss of memory that occurs prior to a traumatic event, such as an accidental head injury or a surgery. So imagine you have a car accident and you wake up from the accident and you realize you don't remember what you had for lunch yesterday and you don't really remember much of that week. Well, that would be retrograde amnesia. Your ability to form memories for events occurring after the accident are fine. You just are missing some memories from the past. Anterograde amnesia refers to losing the ability to form long-term memories after you sustain a particular traumatic brain injury, or perhaps it's an invasive surgery. An example of someone with anterograde amnesia was HM. Because of HM, the world now knows that it's the hippocampus that is responsible for allowing us to form new long-term memories. His surgery had his hippocampus mostly removed, and so for the rest of his life he woke up feeling as though it was the day after surgery. You are likely also familiar with the memory disorder dementia. This is a general term for the loss of memory, language, problem solving, and other thinking abilities that seems to occur most of the time in older adults. It's important to keep in mind that there are many different kinds of dementia. We will talk about Alzheimer's dementia in depth. Memory problems are among the first signs of Alzheimer's dementia. Most people are over 65 years of age when the first symptoms appear, although there are cases of people as young as in their 30s who develop Alzheimer's dementia. Interestingly, the changes in cognitive ability can be detected if one is assessed maybe 10 to 20 years before the major symptoms appear. The hippocampus is among the first brain areas that are affected in Alzheimer's dementia, and so some of the earliest symptoms include forgetting what you've just talked about or something quite recent. Brain scans show that these regions begin to shrink early in the disease. This PET scan image shows how much brain tissue is lost as Alzheimer's disease progresses. The black area in the center of the image on the right shows you where brain tissue used to be and where there is no longer brain tissue. Brain tissue degenerates in Alzheimer's disease due to the buildup of beta amyloid plaques, as you see in the image here. There is also a buildup of tau protein that you can see as tangles in the brain tissue. These also contribute to the death of brain cells. The causes of Alzheimer's disease are still not thoroughly known. Some cases are due to genetics. There are at least 4 genes that may put you at a greater risk of developing the early onset form of Alzheimer's. This is the kind that occurs before age 60. Other cases seem to be related to epigenetics, things you experience in your life that may affect how your genes are expressed. These include lead exposure, exposure to some pesticides, such as DDT, and also the number of head injuries or concussions that you've had in your lifetime. In part due to the rapidly aging population in the United States and around the globe, Alzheimer's disease is expected to affect many more people as a percentage of our population. So by 2050, you're going to have 13.2 million cases just in the United States. There has been increased awareness recently of the dangers of traumatic brain injury, not just the repeated traumatic brain injuries, but also a single brain injury, which may leave you with some memory loss. This diagram shows when one falls and hits one's head, there is bouncing around of the brain inside the skull, which can lead to bleeding and the damage of tissue in that area. So the most commonly damaged areas of the brain following a TBI would be the frontal lobes and the temporal lobes. When we look at who's most susceptible to traumatic brain injuries, it turns out that men are more commonly the victim than women. This is shown in this graph. Overall, sports accounts for about 21% of all traumatic brain injuries in the United States. Each year, there's about 1.5 million people who experience some form of traumatic brain injury. 85% of people will have mild TBI and no long-term symptoms. 15% will have mild TBI and have some lingering or long-term symptoms. Many people don't even realize that they've sustained a mild TBI. Studies of sports-related head injuries show that there's between 1.6 and 3 million head injuries due to sports each year in the United States. These lead to about 135,000 emergency room visits, and they affect usually children between the ages of 5 and 18 years of age. Over the last decade or two, we now know that sustaining multiple brain injuries over your lifetime can increase the risk that you will suffer from dementia-related symptoms due to a brain degenerative disease. And this disease is called chronic traumatic encephalopathy, or CTE. Individuals with CTE develop memory loss, behavioral problems, speech impairment, and even depression. The work of Anne McKee at Boston University has shown that the degeneration of brain cells in CTE is due to the buildup of tau protein. Here in this image, you see the normal brain on the left and some mild buildup of tau. The person had CTE. And then on the right, you see a case of severe CTE where the very dark areas is a tremendous buildup of tau protein. On this slide, you see the brain tissue from an 18-year-old high school football player who had multiple concussions, and after his death, his brain was autopsied, and Anne McKee could find serious buildup of tau protein even in his brain at such a young age, 18 years old. At UCLA, they've developed a new PET scan that actually can detect tau protein in the brain, so a person does not have to be passed away and having their brain autopsied for scientists to find the tau protein in it. In the future, one may be able to take a PET scan and be able to quantify how much tau protein is in their brains. As you see from the slide, the Alzheimer's patient has relatively low levels of tau protein compared to those people who sustain brain injuries, football players, and military personnel. That's all for now.